I'm Dr. Stephen Smith. If you were to ask me what one supplement I could take to best improve my health, this is the one it'd be. Vitamin D3. And the 50 stands for 50,000 units. Why? Well, in adequate doses, and the key is adequate. For example, there's a study showing that you can reduce your risk of breast cancer if you're a woman by 80% if you have vitamin D levels of around 60 nanograms per milliliter versus the average of about 20. Now you'll get bone health at 20 or 30, but you will not get this other additional help to prevent breast cancer. It also helps your immune system in other ways. So this is why I recommend vitamin D 350. And the other reason is it's very inexpensive. It's about $30 for 100 capsules. And for a woman, that's about one capsule a week. So it just comes out to something like 9 cents. And a bottle will last a couple of years. For men, you also get risk reduction of prostate cancer. And there's conflicting studies about the benefits of vitamin D in heart disease. But it does appear that it helps the heart heal if there's damage when you have adequate levels of vitamin D. So what is the range? Well, it's controversial, but the normal lower limit is 30, the upper limit is 100. People at the Vitamin D Council tell me that Costa Rican lifeguards have levels up to 150 and without any ill effects. So I shoot for 60 to 100 in my patients, but I think 70 is probably the sweet spot. And I never measure vitamin D in anybody that's just coming in unless they're already on it, because I've measured hundreds of patients and no one has had a normal vitamin D level. Now this may be different in the south where the sunlight is more direct, but up here in the northwest, nobody gets enough vitamin D from the sun. So I recommend everybody take vitamin D, and I use the 50,000 because it's convenient. I happen to take 100,000 because I'm a guy and I'm a bit bigger, and then if it's flu's going around or something, I'll up that to 150 a week. Do not take calcium if you're taking this level of vitamin D because it can cause bone spurs, it can cause your calcium to build up to the point that it can cause kidney issues. So you do not need to take any calcium because with this level of vitamin D, you'll just absorb enough calcium from your food or wherever else you need. Take magnesium, but not calcium. So I would recommend for D3, 1 for women per week, 2 for men. And I think you'll find you're healthier. And certainly the data is clear that you will reduce your risk of certain kinds of cancer. Thank you.